Hey, everybody. Thanks so much for joining us today. It's me, Dr. Sarah from Core Health Chiropractic with my little buddy, Wyland. Today is a great day for a great day, and I am here today with Dr. Angie Pufahl, and I have known Dr. Angie for several months now. We started working together a little while ago, and so here we are today, and I'm so excited for her to be here. We're going to talk about some of the bioresonance testing that we have been doing in the office. I'm sure you heard us mention it before. I've talked about my family's results with it, and I wanted to just give our patients, our audience, a little taste of more information of what actually the test involves and some more details into it, because we are so excited and we are so happy with the results that we've been getting with this. So I'm super excited. So Dr. Angie, thank you so much for being live with us today.
Yes, absolutely. Thanks for having me. And you know, it's so fun to have a little baby with us too,
Yeah.
right?
Baby.
Oh, smiley too. Yeah, so thanks for having me. Like Dr. Sarah said, I'm Dr. Angie Pufahl, and I am with Remedy Testing, the company that we offer the bioresonance testing for doctors to have in their office. And I'm happy to be here. I'm glad Dr. Sarah asked me to participate. She's got a baby, and I have a puppy that's annoying me right now. So yeah, so I'm here to talk more and answer some questions, and happy to be here. I've been a chiropractor for 15 years. And then I also have my master's in nutrition response testing. And so that's been a lot of fun. And then I learned about this bioresonance testing just over a year ago now. And it has completely changed my practice and my patients' lives. So super thrilled. Yeah.
That's awesome. Yeah, I can say for us, we've been on our course of remedies now for a little over a month, and I've seen amazing results personally with getting my hormones back in balance after having twins, nursing, opening a practice, having another baby, nursing, all that good stuff. So I'm super excited. We're very, very excited to see how this can just help our patients more dive a little bit deeper into what's going on. And this is such a good time, I think, to do this because you can do it from home and you can really start to get to take control of your health in another facet. So I think this is really cool. So Dr. Angie, like, what's the deal? What is this hair and saliva? What testing, like, what's it all about?
Yeah. So like Sarah said, it's a simple, you can do it at home. And so right now, we've been selling so many kits because, right, Sarah, I'm sure you're finding so many people now are being, they're taking more awareness and paying attention to their health. And they're like, what can we be doing to stay healthy? And this is something that you can just have Sarah ship to you. You can stop by and pick it up at her office. I'm sure she'd be happy to arrange either one of those options. She can do phone calls with you with the results. So the hair and saliva testing is all about energy and frequency and bioresonance. And we could dive deep into all of that, but a lot of you probably are not going to understand what that all means. But basically, the exciting thing is what it boils down to is we are all energy, and everything is energy. Everything. So my earrings hold a certain energy versus my hair versus, you know, this test tube versus this pen. Everything vibrates at a certain energy. And so when we take your hair and saliva, a sample piece of hair, or we can use fingernails, and then we also swab the insides of your cheeks and we send that in, we run energy testing against it. And so we're looking at thousands of different viruses, bacteria, funguses, molds. We're looking at food sensitivities and environmental sensitivities. And then we match it against different hormones, test your organs. We look at thousands and thousands of coding for seeing if there's a match with your personal hair and saliva with any of these items that will give us feedback of where there are stressors inside. So it's really cool. It's an easy test. It doesn't take long. We don't have to poke or prod you with needles and take blood. We're actually using your hair and saliva so we can look at things at a cellular level. And so you're actually, with your kit, you'll get a kit that has postage paid. So you're just going to put everything in this bag, seal it, and drop it in the mail. And it's as simple as cracking open this test tube, sterile test tube with a cotton swab inside. You're going to swab the inside of your mouth for 30 seconds. and then you put the swab back in there and seal it, and then you write your name and date on there. And then you just take that and you drop that in the bag. And then with the bag, you're going to put your name and date on here as well. And you're going to, preferably not in the front where everyone can see, right? But
Yeah.
go underneath, grab some hair. You can take little sections, but you want to be able to, if you wadded up the hair, fill a teaspoon at least. So you want to make sure you have enough hair and put that inside the bag. And then you can also use fingernails. So if you'd rather, maybe some men don't have a lot of hair, they could trim their fingernails or their toenails, or you could put a combination of both nails and hair and put that in the bag. So once you have that in there and your name on there, you seal this, and then you put that inside the prepaid postage as well. And then the last thing is you're going to fill out, well, it's not the last thing. There's two more things. You're going to fill out a health questionnaire. Very important, because they have doctors on staff and technicians that are going to read through your information. So we know, if you're on a certain medication or if you're on other supplements, we make sure we find the right regimen combination for you. So we don't put you on something that you might have a reaction to with your medication or that's doing the same thing. But very important, you'll fill all that out. You'll fold this all up and put that in the bag as well. And then there'll be a small ID card. And with the ID card, you're just going to put your name on it. Dr. Sarah's name will be on it. That way, when they get the kit at the testing facility, they're going to know exactly who your doctor is. So they can then take your results and email her the results right away when they're done. So it's a really cool process. And bioenergy, testing, it's all based on those energy signals bouncing back and forth. And so if we find a match, we're going to let you know, did we find something that represents a parasite or a virus? And so we can help you break it down. And so you can really have a better understanding of all those sensitivities, what things are probably holding you back or hindering you from reaching that full or high health potential, right? Because that's what it's all about. None of us are 100% perfect. We're always striving. We're always being exposed to different things. And it's just finding what would be best for you. The coolest part, when your test comes back, there's no two tests that are ever the same. I've done hundreds of these on my clients, and I've never seen the same test, right? It's very unique to just you. The first page will show them the 14 main body systems, and it's going to score them from 0 to 100%. No. So you'll find out how.
Yeah, I love that. I love how specific the testing.
Right. And it'll show.
I was like, whoa, there's a lot of stuff going on, especially with our girls too. And I mentioned that before, if you've heard me talk about this testing, is that there was so much that we found that was really holding us back in ways that I really didn't even fully understand.
Right. And you gain that better insight to maybe there's an area of your body you didn't realize wasn't functioning, as high as another area. So it's very interesting. It'll also tell you the most stressed organs. It will be approximately 7 to 10 pages long. So it's a lot of information, and it'll go over, the food sensitivities. It'll go over the energetic toxins. It'll tell you at the end, my favorite part is it'll even take your hair and saliva, and it'll match it against the exact right nutrients that you need, whether it's a homeopathic, whether it's an herb, a vitamin, or a mineral, to create the exact right combination for you. So there's never any two people that are ever the same, because it's unique to their hair and saliva.
Yeah, I think that is so cool. And I loved how specific the testing was. I was shocked and amazed, like how spot on for several of our patients, their like symptoms or maybe some underlying conditions have been showing up with the testing. Another thing that I really love too is that it didn't matter what time of the month that we did the testing, because if we're doing a female hormonal pattern, it does matter. That stuff really matters what time of the month, so you're going to get different information. So it's so nice that we don't have to wait, or we don't have to do multiple tests to find out a baseline, which I thought was just like really great. And it's so compact and so detail oriented. And I always tell people, actually, like my test was, I had sensitivities like pages long. Actually, my sensitivity worse than anybody else's I've seen. So it was really interesting. So it's so interesting. And I loved how specific it was, because you're right, Dr. Angie, when I'm like, hey, you should, maybe you need to take blah, blah, blah supplement. You never really know how well it's going to interact with maybe something that someone is already taking or with their personal biochemistry. We are all made so differently that it is different. And we have 5-year-old twins, and we did them, and they did have some similar things and some really opposite things. They're not identical. They're fraternal. So they're like two little different people. Yeah. But their regimens were really different because one needed to do more of like a parasite cleanse, or the other one had maybe more like bacterial stuff. Yeah. So it was really interesting. Those two little people who are very similar, raised the same womb, all that good stuff. They're different, and their DNA is different. So I thought it was amazing how specific it was. And we've seen some really awesome results. I'd love to share my results real quiquely. I don't remember if I specifically went into it, but like I said, I really wanted to see where my hormones were. I wanted to see, did I have any imbalances in like what I'm eating? Am I missing some food or nutrients? I wanted to see, am I eating something that's really like setting me off inflammatory wise? And am I healing postpartum really the way I need to? I'm 9 months postpartum now, but postpartum rehab is really important to me, and it takes a very long time. You're really never out of that postpartum if you've been pregnant. And I've actually lost about 15 pounds since I started my remedies, and I wasn't doing anything with my food, but then I did I added in another food thing, which I'm going to talk about in another live, which I was working with another person who is really great at helping with nutrition and stuff. So all those things combined, it's not a one size fit all, but my body is now able to let go of some of the weight that was hanging on to it because it doesn't need it. And so that's been really great. So for me personally, it was really awesome. So that's awesome. So like, Dr. Angie, what are some of like the most frequent questions that you get? And maybe I'll ask you some of the most frequent questions that I've been getting so we can kind of get a more broad baseline.
Sure. Yeah. I would say one of the biggest ones that we get is people get confused thinking that we are one of the Facebook ads that you see, that we're a DNA test. We are not a DNA test. We are taking your hair and saliva and doing bioresonance testing, which is, yes, looking at a cellular level because it's reading your live energy, but we're matching it to different energies to see where there's a balance and where there's out of balance. So one of the big concerns people have, because what you hear in the media is, oh, those DNA tests, they sell your results. Yeah. We do not do that. No. We are a small private testing facility that work mainly with doctors like myself and Dr. Sarah and the handful of other doctors. We hire them to run the test for us, process and put it into a report form so we can give you a nice pretty report and tell you all the results, and then your samples are destroyed. So if you call me in 2 months and say, hey, can you rerun my hair and saliva? No, you need to do new hair and saliva because your hair and saliva is gone. So that is a big concern people have. We are a small testing facility. We like to keep it that way. And we do not sell any data or information. That's a big one. A lot of people ask if we'll like diagnose cancer or Lyme's or diabetes. We do not diagnose anything. This is a tool simply. This is not a diagnostic tool. This is a tool for us to gain better insight to where you're at with your health from the inside out. So similar to chiropractic, right? We're working from the inside out. And this just gives us feedback so we can see where the main stressors are. And like you mentioned, right? You started working on things and the weight starts dropping off. A lot of people, I hear that all the time. Maybe they didn't even want to lose weight, nor that wasn't even a reason why they did it. But when you start detoxing the body, so can we see, factors and viruses and bacteria and stuff that might represent that, but we don't diagnose somebody. Right. So I want to make that clear. Another big one is, what age can do this? Yeah. This was one of Dr. Sarah's first questions. Right. Any age. So you can swab the inside of your baby's mouth. You can trim their fingernails or what little hair they have. You can do this on an elderly person. We even do pets.
Yeah, that is really cool. I haven't even really started to talk about that. But yeah, the pet thing is really cool because it's really hard. Pets don't talk. So you don't really know what's going on with them.
So many pets.
More diagnostic tools.
Yeah. So very, very popular is people like to do their pets. So they stay on top of their pet's health. A lot of times we find out the foods that they're eating, they're sensitive to. Lots of health ailments with especially dogs, you know, that we've seen huge, great success with. So, you know, whether it's swapping out their food, we learn they're sensitive to their food, or they have a parasite, or, you know, maybe something that represents Lyme. So we can get in there and start to support their system so they can get back on track to better health. So yeah, that's another common question. So yeah, so those are probably some of the biggest ones. Make sure that if you're going to do the test, that you put enough hair samples, you know, or fingernail samples. You need to be able to fill a teaspoon. So if you're holding a teaspoon and you wad up the hair, you need to be able to fill that teaspoon. So, you know, I crack up because I can now say I've cut my patient's hair many times. You know, but I'll just grab a little section. I'll cut a little section off here, and then just so it's not a big noticeable chunk, right, in one area. Just grab little sections, put those in the bag, or trim your fingernails or toenails. You can trim arm hair. You can trim chest hair if you're a male. I mean, hair can come from anywhere on the body. Right. So making sure there's enough hair. So those are probably some of the biggest ones. If you know somebody that necessarily doesn't live right by Dr. Sarah, she can ship a kit to them. So you don't have to live in the same town as Dr. Sarah. They can still purchase a kit from her, and then she can do communication with their results by email and phone calls. So that's another thing. So yeah,
I've been doing that. One last question I will ask you. I get this a lot. For your hair, can it be colored? Can you have nail polish on? What's the deal with that?
So I recommend having your nail polish off, you know, and taking it off and maybe not doing a fingernail trim that day, because you just use a lot of acetone probably to take that off. So, you know, give it a day where you've been washing your hands really well, then trim your fingernails. But we've had people that have submitted their fingernail clippings with fingernail polish on it, but we recommend that it's off. And then as far as your hair being dyed, yes, your hair can be dyed. Your hair still internally at the cellular level still holds your energy. So, you know, if you want to wait until you don't have a fresh color, that's fine. But either way, I always tell people, because I had this one lady, she's like, well, you know, what if it picks up like the metals and chemicals of my hair dye? And I said, well, do you color your hair on a regular basis? And she's like, yeah. I said, then those would be accurate results. Because if it picks up, right, hair and or the metal and chemicals, that's what she exposes herself to on a regular basis. And if it's interfering with her inner health, we would then find that out. So I dye my hair. I still do my tests. Yeah. So yes, you for sure can have dyed hair.
Cool. Awesome. Well, thank you so much for coming on live. I hope this was a little more information for you. If you're interested at all, or you think, I wonder if this might be something that would work for me, or maybe I have this question that might, maybe would it work, would it not work? Was this a good fit for me or a good time? You guys can always reach out to us. You can call the office. You can private message us on Facebook. We will get to all of you. Excuse me. We'll get back to you. So we have been so excited. I should have water, but I have no water. Excuse me. There we go. So we've been so excited about this test. We've been getting such great results with our family, with our patients. We have about 10 kits left. We're starting at our introductory price of $299. That includes a complimentary follow-up scan. That is a $79 value. We're just lumping it in because I want you to get results. And then I want to see where are we at. It doesn't make sense to me to do something and that non-measure it at the end to see, like, did it make a difference? Did it not? We're all about objective finding. So we want to know, is this working? Is this working for you? There are so many levels to this. It's amazing. But if you think that this is something that you might be interested to you or you and your family for your health, Now is a great time. You don't have to leave the house. You can still work on yourself. Get in our introductory price, which is $299. We have about, like I said, about 10 kits left. We're so excited about it. You're going to get follow-up phone calls with myself. We're going to go over all of your results. What do the remedies look like? What kind of supplements does that look like for you specifically? How do you take them? When's the best time, with water, with not water, with food, with not food? All that stuff. We're going to go over it and we're going to monitor. And I'm so excited. So like I said, if you're interested, let us know, because like I said, we only have about 10 kits left. So let us know.
Awesome.
Well, thank you, Dr. Angie, so much for coming on. And I hope you have a great rest of your day.
Thank you. You too. Thanks for having me. Bye, everybody.